back. Could the number of people dying in the state indicate that the pandemic is finally behind us? In Michigan, data from the Department of Health and Human Services, first reported by the Detroit News, shows as of this summer, the number of deaths dropped back to where they were before COVID.
It is the first time that we're seeing numbers this low since before the deadly pandemic swept across the nation. Dr. Matthew Sims is an infectious disease physician at Corwell Beaumont Hospital in Royal Oak. Thank you for being here with us.
Oh, you're welcome.
So obviously a lot of people wanting to celebrate these numbers, but we do know that there are still cases that are circulating. Yeah. So what are your thoughts on what we're seeing right now?
Yeah, so the numbers are actually going up right now, but for the most part they're still mild. Though we have seen a couple of deaths here and there, usually in older people, people with immune problems, things like that. So it's not gone, and I wouldn't say we're at the end of the pandemic, but certainly we've come out of the time when this was, killing a large number of the people who got it.
You think back to three and a half years ago when so many people were locked in their homes just terrified, and we all kept hearing one day this might be just like the flu. It's going to be mild. Do you think we've made it to that day?
I do think we've, for the most part, made it to that day, but just like the flu, people who are vulnerable, are vulnerable to this, and they can have serious consequences. And the other thing is, the flu doesn't give us something like long COVID.
Right.
So people who get it, some still get this really debilitating illness that follows it for, months to years.
And still a lot of mystery around long COVID, right?
Yeah, it seems to be immune modulated, so it's something about how your immune system responds. But we don't have a real good firm handle on it yet.
Scary situation even still to think about how when this first happened, really we were all losing someone we knew. It was just every day the numbers were so scary. So to see that it's a little bit under control now, what do you contribute to that?
I think there's a couple of real reasons, some good and some not so good. I think the good reason is the majority of people have antibody against COVID now, right? Whether they got it because they got vaccinated, whether they got it because they got COVID, or whether they got it for both. So the majority of people are vaccinated. That protects them from the really serious consequences. It doesn't completely stop them from getting it, as we know, but it really reduces hospitalizations and death. So that's great. The bad one is that a large portion of the people who were really at the most risk were already, affected by it, and we lost a large number of people who, we're not going to lose again.
Yeah, so many people. What do we know about those antibodies, and what's the latest on immunity? If you have had vaccines, a number of boosters, or the infection, what does that do for you going forward?
What it really does is protects you from getting very sick. It does seem to reduce the rate of long COVID as well, though exactly how much, it's hard to really estimate. But if you're vaccinated, we know that you have much, much lower rates of needing to be in the hospital or dying from it if you get it. So that's the major benefit.
As you've mentioned, the virus is still there, so this wouldn't be a time to get laxed, right? Especially as we get into flu season.
Yep. So, the new booster just came out recently. I'll be getting it early next week, and I recommend it to everybody. My kids are going to get it, my wife's going to get it. It's going to protect us because it's more update. First, it will boost our antibody levels, and second, it's been updated to the more recent versions of the virus. It's the XBB 1.5 subvariant, and it looks like that will protect us from all the major subvariants that are circulating now, even some of the rare ones that have a lot of mutations. So, that just gives you the next boost in your immunity.
So many people have become lax about it. It doesn't feel as urgent as it did just a few years ago. So as a reminder, who are those people? What groups are more vulnerable and should really think about this?
Sure. So older people, certainly over 60, people who already have lung problems, obesity, diabetes, hypertension, and immune deficiency. Those are, if you're immune suppressed for whatever reason, those are the people who are most at risk.
So it looks like things are trending towards a better direction. Do you see us at all at any point possibly getting back to where we're seeing a large number of deaths reported?
I hope not. Like I said, I still every now and again do see a death from COVID. I saw one recently. It's tragic when it happens. But I'm hoping, unless we see a major change in the virus to something that none of the antibodies that we're making protect us, I don't expect to get back to that level.
Well, that is encouraging. Let's hope that is the case. Dr. Matthew Sims from Corewell Health, thanks so much for joining us today.
You're welcome.
Appreciate it.